Welcome to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati Spine Procedures, Alfred Bonati, MD. Now here along with Dr. Bonati, your host, Kimberly Bermel.
Good afternoon, and thank you for joining us for American Medicine Today. I'm Kimberly Bermel, joined by world-renowned orthopedic surgeon, Dr. Alfred Bonati. Thank you for sharing your day with us, sir. And as well, we have Ethan Youker, our executive producer of our radio program.
Indeed, I am here.
Yes.
Pleasure to be here.
All right. Well, every week we speak to patients that have been helped by the Bonati Spine Procedures. And we have said Bonati succeeds where others fail, and that's true. We have over 94% patient-reported success. And with that being said, over the years, we try to have continuity in taking a look at results. And we have different time frames, and they're pretty much all the same, but since it's not a continuous date, we have to break that up. Well, over a 7.5-year research that we've done with patient satisfaction, we are at 98.75%.
That's unbelievable.
Unbelievable in the medical field, or anywhere, let alone spine surgery.
I always joke that, you know, it's like weather guys, meteorologists are the only profession where you could be wrong almost all the time and you still get to keep your job. Not so in medicine.
No,
you know?
not at all.
And Dr. Bonati is just about, you know, he's just
as perfect as you can be.
Just a hair from perfect. Stop staring at me like that.
It's a big hair.
It's a big hair. A big hair from perfect.
It's a big hair. It's more like a rope.
No, but in all seriousness, he has brought help to the masses. And we're not just stating, like other places do, that they've performed surgery, but actual true patient resolve. That is what you get with the Bonati Spine Procedure. So not all spine surgery is the same, and you only get Bonati at Bonati. And he knows what he's speaking about because he actually came from the background of traditional open back surgery, and he saw the ineffectiveness of those procedures and wanted to do more. So he set out, he developed his own patented exclusive procedures and the instrumentation to make that possible. And that's what you have anytime you reach out to the Bonati Spine Institute.
When you drive by the Institute, it says on the sign where minimally invasive spinal surgery began, because he literally invented the whole field, really. So when there's a lot of imitators out there.
Yeah, when they talk about leading the way, he is the leader, and he continues to pave that path. With that said, coming up on the show, we're going to be speaking with Dr. Hal Urschel, and he's going to be speaking about substance abuse.
Yeah, he wrote a book. We actually had him on our television show earlier in the week, and he was really good, so we decided to have him on the radio show. It's sort of a tie-in with Robin Williams and depression, but it also has the angle of substance abuse, and it's just really, really interesting stuff. So if you know anyone that suffers from depression, or if you yourself suffer from depression or substance abuse, you might want to give Dr. Urschel a listen coming up later on.
And then we'll hear what's new in American Medicine Today with Dr. Bonati himself. But up first,
in today's Back to Life segment, we will talk to a patient of the Bonati Spine Institute who went from living a life that was restricted by pain and discomfort through their journey of finding the Bonati Spine Institute and are now living pain-free.
Well, I'm pleased to introduce to everyone Joann Davis. She's dialing in from Bozeman, Montana. So thank you for sharing your time with us and explaining your situation, how you ended up in pain.
Start us at the beginning, Joann. How did you initially begin to feel pain? What happened?
Yes. Okay. So it started, I was in a car accident in 2010. I had pain before the accident just from, problems. I really wasn't sure what was causing it, but it started from that time, and then had the car accident. And, the car accident left me with a lot of sciatica problems in my leg and my neck, and I had gone to see several doctors in my area, and basically after several visits and with physical therapy, there was not much they had said that they could do for me. And of course, just the severity of the condition that I was in, I did my own research, and I had, found the several locations of this procedure. But the one that I had sent my MRI to was, for Dr. Bonati, and I then got a call after sending my MRI from Dr. Urschel, and he explained the procedure and that they can help me. And that was like the best news I can hear. And so, because of the severity of the problems that I was dealing with my neck and my back, I was scheduled for surgery in 2011.
Okay.
And so, after going through all of what the procedure was about and just hearing a lot of feedback, I was very comfortable in going to the Institute for this surgery.
Can I ask you one question? You talk about intense pain. Can you describe that for the listeners? Because sometimes they're going through that. So was it localized to one area? I think you mentioned a couple different body parts. So why don't you explain?
Yeah.
Did it travel, the pain?
So, I was dealing with, when I go into the cervical area, I was dealing with my right side of my neck, and I was having pain, continuous headaches, and pain up to the top of my head, numbness down my right side of my arm to my hand, and it was just so bad that I just can barely lift up my head. The pain, headaches every day. And then my back, I just basically was dealing with sciatica on the right side, and it was numbness all the way from my lower back down to my foot, and wasn't able to walk that well, and was tripping and just had a lot of issues. And, when the doctors here would tell me, there's not much you can do, I was like, well, seriously, I'm not going to be living a life like that.
It's amazing how, Joann, sorry to interrupt, it's amazing how often we hear that from the patients that we have on, where they've gone to other specialists and sought other treatment, and they're just told that they're going to have to live with it. So that must have been crushing. And the thing that I find great is that, and I know I would be the same way, if I was in pain like that and a doctor told me that, I wouldn't accept that, and Joann didn't either. That's got to be really hard to just swallow. I mean, so then you discovered Dr. Bonati?
Well, actually, what type of treatments did you seek out? Did you try anything less invasive first, more conservative?
Basically, it was a lot of physical therapy, and they themselves said, Joann, after so many sessions, you need to go back to the doctor and tell them they did all that they could do. So I did a lot of physical therapy. I had an injection in my back, which never helped, and that was really all that was suggested for me. There was not much else. Around in my area, I don't know other areas, but here, if they ever did surgery, they do a lot with, hardware, and there was just no way. I mean, even suggesting if there was any surgery that's what they were going to do, I did not want to go that direction.
Right.
So basically, that is all that was suggested, and just do whatever I can do to make myself comfortable is how they left me.
So when you ended up at the Bonati Spine Institute, again, I'm sorry I interrupted. I just wanted you to kind of elaborate on that. When you actually spoke with Dr. Bonati, or who was your doctor at that time? My doctor who started the first couple of procedures in 2011 was Dr. Youker. Okay, perfect. What was that like when you were actually in person and being evaluated? Did you feel like they were able to really get to the root of your problem?
Yeah, what was the experience like?
The experience was it was remarkable. I mean, I went in there, and they basically wanted me to explain everything. And, from my past time of reviewing everything, I would just get these stares and looks like they didn't know what else to do, or they didn't believe me. But when I went there, they knew exactly what I was dealing with. And just knowing that, I knew I was in good hands. And they just pinpointed exactly what I was dealing with. And that confirmation was like, okay, I'm in a good place. I know I'm going to get help. So they knew exactly what I was dealing with, and that, there was something they can do for me, and that was very reassuring.
Yeah, that must have made you feel fantastic. So how was the actual procedure? Do you remember much of it? Were you, because they do the conscious IV sedation, so you tend to be awake, pain-free but awake, so that the doctor can kind of pinpoint where your pain is. Was that how your experience went?
Exactly, yes, it was. When they first tell you, the anesthesiologist, you're going to have to tell them when they're hitting a nerve or something, just tell them where it is located. Well, yes, the first time it was a lot, and so I moved, and it was really okay, because the anesthesiologist was like, where does it hurt? And then they stepped me through it. So they guided me through the whole thing. and it was fine. You know, I knew what I needed to do. The staff was excellent to help me out, and you know, actually after the surgery, part of the surgery, they'll say, you know, why don't you move with whatever area you want to move to see if it's still there, the pain. And so I went through all that, and I was, you know, communicating with them throughout the whole procedure. So it was fine. It was really a remarkable procedure.
Did you know why it was so important to have the conscious IV sedation so that you could be interactive with the doctor?
Yeah, you know, knowing this beforehand, too, I've asked many questions before I even went there. And again, just reviewing it, basically they need to know just so that, you know, there's less damage to your nerves, and just so that they know they're in the area that is where the pain is. So it's just more, you know, causing less damage to the area, and just letting them know that if they're hitting the nerve, where it is that they're hitting, and just that communication is what they need to know.
Yeah, it makes perfect sense, really, if you think about it, because, I mean, if you're totally knocked out and unconscious during a surgery, how is the doctor, you know, how would the doctor even know, you know, where, if they're in the right spot or whatnot? So it makes it makes perfect sense. So so how are you feeling today, Joann?
You know, today I'm feeling really well. I had procedures in 2011, 2012, and then again this year, 14. And, you know, Dr. Bonati helped me out this, you know, for this few weeks ago is when I had the surgery. I had 4 surgeries, and it was great. I mean, I went through a lot, and I'm, you know, doing really well now. I had a few calls back to the Institute just to find out, you know how I'm doing, and just to let them know what I'm experiencing. But actually, I'm fine. I've been walking. I mean, you walk right away after surgery. I've been walking like 3 miles a day. I mean, I'm doing really well. I don't have the pain that I had when I got there, and it's been very successful.
That's awesome. Well, as we wrap up with you, Joann, Dr. Bonati's here if you'd like to say anything to him.
Hi, yes, Dr. Bonati. I just want to say thank you so much for helping me. I am doing really well as of today, and I'm just so thankful for all that you have done for me. It's been just a remarkable way through the 3 years I've been there. I highly recommend it to many patients. I work at a hospital here, and, you know, I just want to thank you, and I have recommended your area to many patients here. So, again, I just want to thank you for helping me out, and, you know, just a better way of living.
Thank you for trusting in us. And I was one time in Bozeman, Montana. I'm never going to go there.
Don't trash your home.
That was so cold, man. I can't believe how you guys can live there.
That's hilarious.
And I was going with a friend in a truck, and this guy goes and hit the deer.
Oh, no.
And I'm telling you, that was so horrendous experience. So when you say Bozeman, Montana, I go, oh no, don't tell me I need to talk about that.
Long winters, I know.
Well, all right, Joann. We appreciate you joining us on American Medicine today, and again, continued pain-free living.
Thank you very much.
Thank you.
Have a great day.
Thank you for trusting in us.
Oh, Dr. Bonati, thank you very much.
You got it. Have a great day, Joann. If people want to get in touch, how do they do so, Kimberly?
They can reach out to the Bonati Spine Institute at 855-267-0483 or Bonati.com. You are listening to American Medicine Today on News Radio 970 WFLA. Coming up, we have Dr. Hal Urschel, and he's going to be discussing substance abuse and depression. Up next, after the break, you're listening to 970 WFLA. Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine Procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine Procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
This is the first time that I am pain-free after 18 years, and it's just wonderful. I love it.
Phenomenal results, no pain whatsoever.
My pain is virtually gone, nothing short of a miracle.
Those surgeries gave me my life back.
Already I feel like a new person.
I'm going home new.
I can chase my grandbaby now, I can garden, I can cook, and I'm really thrilled. The outcome has been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine Procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine Procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
You're listening to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati Spine Procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Bermel.
Thanks for continuing to listen to American Medicine Today this Saturday, brought to you by the Bonati Spine Institute. I'm Kimberly Bermel, joined by executive producer Ethan Youker.
Good to be here, as always.
And still alongside us is world-renowned orthopedic surgeon Dr. Alfred Bonati. Now, on the phone, we have Dr. Hal Urschel, and he's joining us. He's the Chief Medical Strategist at Enter Health, one of the nation's leading drug and alcohol addiction treatment centers, and he's also an author of Healing the Addicted Brain. So thank you for being here, sir.
Thank you for having me today.
And, you know, how topical is this? Because, unfortunately, we lost one of the funniest men on earth, Robin Williams, due to depression. And I don't know about you. I'm very sad every single time I think about it because he tried to make everybody else smile and do so much good.
He was so tortured inside, though, because if you've seen interviews with Robin, he was when he wasn't totally manic and in character. If you occasionally you would see a glimpse of the real Robin, and you could tell there was definitely a sadness behind those eyes. Would you agree, Dr. Urschel?
Absolutely. There's you know, obviously we know he struggles with depression and probably manic depression, although I'm not for sure on that, but recurring depression is a real problem for a large number of Americans, and we also know that he was struggling with alcohol and drug addiction, and the combination of those two brain illnesses can make a significant impact on a patient's thinking process and his mood states or her mood states, and when treated correctly, you can make a huge difference in an individual. But sometimes, if you're going out and using substances, when you have a depression or you're in a manic phase, it can really significantly unbalance the chemicals, and probably something atrocious happened in his brain to make him think that he wanted to end his life, and that's obviously a tremendous tragedy. I think one of the best things we can do as a society is learn from that, and let's try and create a legacy of helping because of his death and the sadness we all fear. Let's try and help leverage that into figuring out how other people to avoid the same situation. I can't think of a greater legacy.
Doctor, can I ask, how do you know the difference between just the blues and true full-onset depression?
Great question, Kimberly. The blues may come for a few days, maybe even a week. True clinical depression occurs over a month or 6 weeks period. The real difference is the severity of symptoms and the fact that it just won't go away. It just really hangs on. Now, you can be really depressed and you might have an hour of a day that you feel a little bit better, but most of the time you're feeling depressed, sad, blue. Your energy is low. You have significant fatigue. Your motivation is hard to get up and do anything.
Right.
Many times your sleep will be very erratic, either way too much or way too little. You have significant anxiety. Your self-esteem gets really low. You feel guilty about things. You feel very hopeless. And so all of these factors are being influenced by your brain changes. Your depression and manic depression is a result of certain neurotransmitter systems or your brain chemicals getting out of balance, either too high or too low. And when they're not in balance, you feel very uncomfortable. And when they're not in balance, you start not thinking clearly. And then when you're not thinking clearly, you can't shut off these thoughts, these very depressing thoughts of, I feel like I need to end my life.
You know, I have a couple other questions because we see all the time on TV. There's so many medications prescribed for depression, and some of the side effects could be that you become suicidal. And then not only that, but then some of these medicines that people are on, they cannot just be suddenly stopped. And once that happens, normally when you take a supplement or something like that, doesn't it reduce the naturally occurring chemicals in the brain? So is there more problems once you are on medications?
No. Well, first of all, everybody's different, and we're always learning about the new insights and new. We are always getting more and more additional understanding of the brain. Okay, but what happens with the neurotransmitters is when they get too low, you get depressed. You get all the symptoms we just discussed, and when you use an antidepressant, it will help within 4 to 6 weeks in many cases. And you shouldn't just use an antidepressant by itself. You need to be using therapy and exercise and wellness and stress management, the whole ball of wax, like you'd use to treat any chronic illness.
Right.
But when you're using all the different tools you need to get better, and antidepressants being one, your neurochemicals go back up to the normal level. When they're at the normal level, we encourage the patient to stay on the antidepressant for about 12 to 18 months. Then after 12 to 18 months, they've been able to make other positive changes in their life, help focus on healthy coping skills, etc., good exercise. And so at that point, you can pull the antidepressant away, and in most cases, the patient does not relapse. Okay, back to depression. Now, if on top of this you're drinking alcohol, you're using cocaine, you're smoking pot, all these things are central nervous system depressants, so those are short-circuiting the effectiveness of the antidepressant. And in some cases, you don't just have depression, you have manic depression. Manic depression is a cyclical state of mood swings where your chemicals go up and they go down, and they go up and they go down. And so for those people, you need a mood stabilizer, a different type of medication, and many times you'll need to stay on that for the rest of your life. But, if you have a heart problem, if you have an orthopedic problem, sometimes those things are not going to go away, but you do have medications that can help you deal with those.
And Dr. Urschel, you were talking. We're talking off the air a little bit, and you were telling me about shots. There's shots out there now that can treat alcoholism and I believe opiate addiction
Absolutely.
as well.
If we focus on an alcohol and drug addiction, the people, there's even more of a negative stigma associated with alcohol and drugs, and so people feel that society in general feels even less hopeful that you can treat alcohol and drugs effectively. That's because most of the time, most people getting treatment for addiction are getting treatment with just using the AA, the 12-step approach, which is a good approach, but it only is about 25% effective. What you need to do is you need to treat alcohol and drug addiction as a chronic brain disease, because that's what the National Institutes of Health, our main research body of knowledge here in the United States, has shown us to be. And so you need to be able to use medications in many cases, especially with alcoholism. We have a shot now. It's called Vivitrol. You get it once a month. It puts a little bit of medicine into your body every day, and it decreases your cravings for alcohol by up to 90%. It keeps you from getting drunk, not by making you sick, by just essentially turning alcohol essentially into water. You can't get high. You don't feel euphoria or any pleasant feeling from drinking alcohol, and it decreases the number of drinks that you would drink if you do pick up.
What's the name of that shot again? We're almost out of time, Dr. Urschel.
It's called Vivitrol, Vivitrol. If you want more information, you can go to our website, enterhealth.com, and we have a lot of information on there. It's also in the book, Healing the Addictive Brain. It's been approved by every major insurance company out there. It's been around since 2006. The medicine that's in the shot's been around since 1965, so it's nothing experimental, but it's incredibly effective. Most physicians have never heard of it. Most treatment programs won't use it, so it's really up to the American public. If you have somebody struggling with alcohol or drug addiction, contact us, and we'll be able to make sure you get access to the Vivitrol, because that can be life-changing. Think if you had a shot that would prevent you from getting drunk for a month. How huge is that?
Yeah. Yes. Well, it's very interesting stuff. Appreciate you joining us, Dr. Hal Urschel, again, Chief Medical Strategist at EnterHealth, enterhealth.com, also the author of Healing the Addicted Brain. We appreciate you joining us, sir.
Thank you very much.
Have a great day. All right, that's interesting stuff. Now, if people want to get in touch with Dr. Bonati, if they have back or neck pain,
sciatic pain, migraines, RSD, they can reach out to the Bonati Spine Institute. They have helped thousands. Call 855-267-0483 or visit Bonati.com. After the break, we're going to hear what's new in American medicine today. Stay tuned.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine Procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine Procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
This is the first time that I am pain-free after 18 years. And it's just wonderful. I love it.
Phenomenal results. No pain whatsoever.
My pain is virtually gone. Nothing short of a miracle.
Those surgeries gave me my life back.
Already I feel like a new person.
I'm going home new. I can chase my grandbaby now. I can garden, I can cook, and I'm really thrilled. The outcome's been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine Procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine Procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
You're listening to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati Spine Procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Bermel.
Good afternoon, and thank you for joining us for American Medicine Today. I'm Kimberly Bermel, joined by Ethan Youker and world-renowned orthopedic surgeon Dr. Alfred Bonati of the Bonati Spine Institute. Well, we're excited because we have John Stossel, investigative journalist and libertarian columnist and host of Stossel on Fox Business, joining us on the phone. So we're big fans of your show, John, And
you have such good judgment.
I would say so. We've been fans of you from many, many moons ago. 2020.
2020.
We want to ask, what is your take on Obamacare, the supposed Affordable Health Care Act? And then we'd like to also touch on the ongoing veteran scandal.
My take is what I learned from 25 years of consumer reporting is that the market works better than anything else, imperfect as it is. And we don't have it in medicine. Republicans often say, well, they're killing the free market in medicine, but we haven't had that since we gave special tax preference to company insurance policies. So the only way a market really works is when the individual deals directly with the provider.
Right.
So you want spine surgery, you go to the doctor, and the doctor says it's going to cost you this, or you're poor, I'll make you this deal in chickens. Whatever it is, it needs to be one-on-one, where then the patient shops around and decides, do I really want this procedure or not? And you can say, well, they don't have enough information to know if they need spine surgery or a heart treatment. It's not a market. But it is. Everything can be a market. Cars are more complex than anybody can understand, and yet we have good competition in cars, likewise, computers and cell phones. You just need a few people who are passionate and study it or are experts, and through word of mouth, the good news and the bad news spread, and everybody improves. You look at the one area in medicine where you got a free market, or two, really, plastic surgery and LASIK eye surgery, procedures where the patient pays himself. And what's happened? The prices have come down, and the quality has gone up. The doctors give out their cell phone numbers to patients because they have to compete for patients and keep them happy.
Right.
But Obamacare makes this sort of other people deciding for you destruction of the individual choice that makes a market work. Obamacare accelerates that.
What are your thoughts on the constitutionality of it, John? Because that seems to come up again and again. Is this something that the president should have the authority to make people purchase health care?
No, but the Constitution is not my specialty.
Right.
Okay, nor is it President Obama's, I do believe.
And I do wish that people would get the difference between rights. You have a right for this. Well, you have a right to be left alone. And the Constitution is filled with that. The right to free speech means you have the right not to have someone order you to shut up or to order you not to practice your religion. But to say you have a right to health care means that you have a right to take stuff from other people, to force other people to give you money to pay a doctor or to force a doctor to treat you. That's very different.
I really think that the major trouble that we have is that physicians themselves are irresponsible to the patient care and medicine. They corner themselves. They talk a lot in the operating rooms or in some type of meetings that they have, but they never go and say, we are not going to accept this. I really think if physicians once for all will pay attention and will say our patients are going to suffer, the quality of medicine is going to go away, and we are going to suffer, and we're going to be employees of a government, that is terrifying. And it's terrifying because look at the joke that they have right now with the VA. The VA is practically a Cadillac of what Obamacare is going to be. And one of the problems is that you see that right now they have a TRICARE that is a type of a service that they give to the vets that they can go to see physicians outside. And they block constantly. It's a sabotage at veterans that they seek civilian care. And then they don't pay the doctors. And then they have a tiny little type of a service that they called an accountability system. So they take months to pay the civilian doctor, and the next thing that happens is they ask for your records, and then they try to bully you to create irresponsible type of a billing. So the doctors are not going to take the vets. That is exactly what every time happens in anybody who is living with a governmental type of a system. So American Medical Association talks about representing physicians. That's a joke. American Medical Association is a crappy type of an association of 16,000 individuals that they serve, that they are associated with. Is a political thing, and more than anything, they serve practically insurance. So the next thing that happens is representing doctors. That is something that we need to reorganize, and we need to create a system where the physicians are going to organize and going to say, we will serve the patients and we will take the responsibility of the system. What do you think about that, John?
You raised several points. I don't agree with your last point. We have to organize. You can't organize. People have tried to find ways to organize to make things better forever. Mm-hmm. That's what communism was. Mm-hmm. If you have a market, then the doctor and the patient quickly figure out what works best for them. Everybody makes changes to solve it every 2 seconds. If you have an organization, then nobody makes changes because you got to follow the rule book. You make changes every 4 years when there's an election. The AMA is no worse than every other trade association. The kind of people who like to run for election and then meet, have long meetings in windowless rooms, are the kind of people who join the Dental Association and the Farm Association. They're the bureaucrats. They become leftists. AARP is supposed to represent old people. Mm-hmm. It's become a socialist organization wanting to suck more money out of the government. Yes, what you say about the VA is true, that they're going to stiff the doctors when they can, and there'll be a balancing act, as there is with private insurance companies. They want to delay payment. They want to make sure it's a real treatment, and to do that, they try to do it with paperwork, and maybe the doctor will lose interest and won't bill. But somebody has to say no, because somebody's going to ration care. Either it's going to be the insurance company, or it's going to be the government, or you. And ideally, it's you, because you know best which choices you want to make. I mean, people are outraged that women have paid more for health insurance, and that's been banned by our pompous politicians. But women should pay more for health insurance because women go to the doctor twice as often.
That is true. My wife uses the health insurance way more than I ever do, so I agree with you on that point, John.
Right. If you're going to call it insurance and not just a handout program, then women should pay more. And if you're paying yourself, then you make a decision. Well, and maybe women are smarter for all I know, because women do live longer. Maybe that's one of the reasons.
We have more preventative care, John.
I don't presume to know. But only when the individual has to pay some more for that extra appointment do you decide, gee, I'd rather fund my kid's tuition.
I like what you say about organization. I am against anything organized, because I absolutely agree with that. But the problem is we are in a jam. We need to get the physicians to respect the patient care, and we need to get the physicians to respect medicine. And to do that, needs to be a voice, needs to be somebody or some group or some type of a very, very strong group that is going to limit the action of the legal system against medicine, limit the intrusion of politicians against against the medicine, eliminate insurance that they are trying to tell you after they deal with you that they are going to pay you whatever they want. But you need to have some representation. Call them whatever. I call them organization, and I think that's the wrong name. But help me to understand, how do you see one physician, without really the backup of the system, can defend medicine and a patient?
No, you make a good point. I mean, he can do it by saying, I'm going to withdraw from Medicare and insurance, and if you want to see me, I'm going to bring cash, or I'll do charity work sometimes. But most can't afford to do that, and most of the money is with insurance companies and Medicare. And yes, you need leaders. There are free market medicine groups, Manhattan Institute. There's some woman in Arizona who's passionate about it, and politicians. But look, people have lives. You talk about the success of Fox, and we crush the cable competitors, and yet we get, on a good night, 3% of the audience. Most people are not interested in this, don't want to do the work. You doctors are busy, and my daughter's a third-year doctor now, and she sees this horrible stuff happening, and it's over at her hospital where they just waste money on unnecessary stuff. But it feels like you can't fight it in the system, and I don't know that you can. Germany and Japan did so well economically after World War II. Why? Because we bombed them to smithereens, and they had to start totally over, and all their old rules and guilds and sleazy collaboration between business people and governments were thrown out the window. And that clean start, it's the same thing happened in Hong Kong and the East Asian tiger countries. They've prospered because they were free to make their own choices.
John, I have a question for you. I know you talk about the difference, and I'm hoping you can explain it here on our show. What is the difference between capitalism and what you call crapitalism?
Capitalism is the free markets. No privileges, no bailouts, no special deals. If you can't win over the customers, if you make a bad bet and lose money, you go out of business, you lose your money. Crapitalism is when you either get bailed out by government or you get special government deals, whether it's contracts because you're a woman or you're Hispanic, or whether it's a subsidy to produce this or that product. So it's crony capitalism, and often the reason you get it is because you know somebody, and because the politician can't possibly look over the whole country and know when the next, say, Facebook is coming, or know when the next cancer cure. Nobody has a clue where this will erupt. My brother gets grants from the NIH. He's lived on those for years, but he's 70 years old, and the inventions come from 26-year-olds. But the government doesn't know who the innovative 26-year-olds are.
What do you think about the people that are receiving any sort of entitlements not being able to vote, because then that would ensure a voter base? Do you subscribe to the thought process of if they're on it and they utilize it, that's one thing, but then that negates them from having a vote to keep it continuing?
I hadn't heard that one. Good luck selling it politically. Just remember, almost everybody is on the dole now in some way. We're anybody over 65, anybody poor, we're getting subsidies. I get one when I ride the subway in New York. Be very hard to sort out who can vote and who can't.
All right. Well, we certainly appreciate your time, John Stossel, investigative journalist and libertarian columnist and host of Stossel on Fox Business.
I'm sure Doc could talk to John all day long, but we're out of time. Any parting words, Doc?
Yeah, but I like to end saying thank you for your participation with us, and I'd like to get in touch with you. You are so brilliant. We need to have people like you to help us to come up from this mess.
Amen.
Well, thank you very much, and I hate to end on such an insulting note as to say I'm so glad I did not get spine surgery when they told me I should, and I went to this guy, Dr. Sarno, who says your back pain is in your head. How come everybody got back pain when they cured ulcers? I read his book, and that cured me and Greg Gutfeld, Howard Stern, several people at Fox News.
Wow.
Okay.
But if you ever need
it
when
you're really hurt, then we'll talk again.
All right. Appreciate it, John. Have a great day. John Stossel, everybody. Thank you, John.
Thank you.
And he's out.
You are listening to American Medicine Today on News Radio 970 WFLA. If you or someone you know is suffering in pain, reach out to the Bonati Spine Institute, 855-267-0483 or Bonati.com. Coming up after the break, we're going to hear what's new in American Medicine Today.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine Procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine Procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
This is the first time that I am pain-free after 18 years. And it's just wonderful. I love it.
Phenomenal results. No pain whatsoever.
My pain is virtually gone. Nothing short of a miracle.
Those surgeries gave me my life back.
Already I feel like a new person.
I'm going home new. I can chase my grandbaby now. I can garden. I can cook. And I'm really thrilled. The outcome's been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine Procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine Procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
You're listening to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati Spine Procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Bermel.
Thank you for continuing to listen to American Medicine Today. I'm Kimberly Bermel, joined by our executive producer of our radio program, Ethan Youker, and I have world-renowned orthopedic surgeon, Dr. Alfred Bonati. And we just had John Stossel on in the other segment. So I know you have a lot to talk about after that conversation. So Dr. Bonati, let's hear.
What's new in medicine today?
Let's look at what's new in medicine today, featuring Alfred Bonati, MD.
All you, Doc.
John Stossel is, to me, one of the most brilliant journalists of these last 30 decades. It's not only a lot of integrity, but at the same time, it's extremely intelligent. His programs are not only educative, but at the same time, they have the challenge to see both sides. He's not only a gentleman, but at the same time is very keen in his appreciation of what he's asking. I agree totally with him that the capitalism is the best way to correct and save nations and individuals. Now, when you change the capitalism to a chronic capitalism, and you ask for favors or you ask for situations of bailouts and things, then it's not capitalism. That is only a governmental fraud. It's a scam.
Right.
So let's talk about scam. Didn't I say it around 3 months or 4 months ago when we start the complaint about the VA? We were the first ones that they brought the VA complain on the radio.
Right.
Well, when we said that, I said that the politicians are going to show up like bandidos on the system.
Right.
They're going to come over, they're going to look, they're going to talk, they're going to jump, they're going to look very good, they're going to ask to look good.
Right.
And they're looking for their faces to be on public so they can be reelected.
Mm-hmm.
The real truth, the latest scam on the VA is nothing in comparison to the Obamacare. The Obamacare is a VA on steroids.
Right.
The situation is depending everything that means your health on the hands of bureaucrats.
Right.
Not only they're going to shorten your life, they are going to elect when you're supposed to die, and they're going to deny service to you. You may think that is radical, that's not going to happen. Well, we always thought that we never would have in this country a direction of change the best medicine of the world for a mediocre, incompetent, totally disregarding of health care for the patient, but filling up the pockets of the politicians that right now they are like leeches on top of this money that medicine is going to produce for them. Because I promise you, they're not going to go to the patient. They're not going to go to a service that is going to advance medicine. They're going to go to the pockets of the politicians, and that's it. If we don't wise up and put these politicians in place, and we have term limits, we will lose the country, because the corruption of the political system today is beyond imagination. Now, remember when this problem of the VA happened, the Congress rushed to do a law, a fixed bill.
Quick fix.
Yeah, a quick fix bill.
That's the way they do things.
Well, they did that. You know why? Because they're going on vacation. And you know why? Because, good luck, this is not going to work. So the problem is, they look good, they sound that they're doing something, but they're not doing anything. They know what they're doing. They're creating a circle, so you can spin it on it. Now, the worst scam of this bill is the choice card. The choice card is a card that they are going to give to the vets. You will listen from the politicians to tell you how wonderful they are. They're going to give a card to the VA, to the veteran, and the veteran is going to be able to go and choose any doctor he wants in the country. That wasn't one of our suggestions that we have since the beginning. But you know, the corruption is so big that they use good idea and they turn it around and they change that idea in a crappy type of a result. And what this choice card is, when you need to go to a doctor, you need to live beyond 40 miles from any VA facility. And you need to wait the VA to give you permission to look for that appointment. Good luck. The VA is not going to answer your calls and is going to tell you what is prudent for the VA to give you an appointment. Well, if you ask an appointment in New York, it's around 600 days.
Wow.
So are you telling me that it's prudent for the VA in New York to make you wait 600 days? If you do have cancer of the colon, your progress of that disease is going to be so advanced that when you go, you better just kill yourself, because it's beyond control. Now, this card is not only affecting the opportunity that the surgeon, the VA, the veteran can have to reach the private physician, but at the same time, they are inquiring in sabotaging the vets to seek private or civilian care, because what they do is they don't pay the doctor. So they pay the doctor and they make them wait months and months. And the next thing that happens, if you do that, you're not going to have service.
Right.
And that's a look at what's new in medicine today with Alfred Bonati, MD.
So the quick fix is neither a true fix nor quick. I just see a lot more roadblocks ahead, unfortunately, for the veterans that are serving our country, and that's rather unfortunate. If you or someone you know is suffering with back, neck, or sciatic pain, reach out to the Bonati Spine Institute at 855-267-0483 or Bonati.com. We're on Fox Business this Sunday, 5:30 to 6, as well Sunday, ABC WFTS, only this weekend on ABC 28. See you next week.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine Procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine Procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
This is the first time that I am pain-free after 18 years. And it's just wonderful. I love it.
Phenomenal results. No pain whatsoever.
My pain is virtually gone. Nothing short of a miracle.
Those surgeries gave me my life back.
Already I feel like a new person.
I'm going home new. I can chase my grandbaby now. I can garden. I can cook. And I'm really thrilled. The outcome's been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine Procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine Procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.